Hey, how you guys doing? I just got back from the city commissioners meeting tonight, and I went there because I wanted to speak at the general public comment. And the reason why I wanted to speak is that just recently, like within the last, week or so, CNN published an article about the World Health Organization's updated advice or guidance on, who should get the COVID vaccination. And they had, broken it down, and the WHO had broken it down into three groups: high, medium, and low. And they had placed healthy children at the low group, and so not needing the vaccine. And so I wanted to go to the meeting tonight, and I wanted to speak on that, and I wanted to read those articles because, I protested the vaccine clinics here in in Lawrence and Douglas County, both in 2021 and 2022. The first round when it was for children, I think 5 and above, and then in the summer of 2022 when they approved it for or allowed it for beginning at 6 months old, we started protesting those vax clinics as well. And so I just wanted to go there, and I wanted to say, we were right. We were right about vaccines, that they weren't necessary for children, and it shouldn't come as a surprise that they didn't need to be vaccinated. And I also wanted to point out that the reasoning for the WHO changing the level, the risk level or the priority level to low, they said it's because there's less risk for severe disease and death in children now that there's been the vaccinations have been around, and then enough people have gotten the virus and they're immune to it. But that's I wanted to call that out as just another lie, because children were never at risk for serious illness and death. So it's just a straight up lie. I mean, the death rate for COVID, we knew from the very beginning, was at 0.003%. In just the general population, and so it was even lower for children because it didn't impact children. So it was basically at 0%. So I mean, so they went from next to 0% up a notch or something, or down a notch. I don't understand how they could say that they're at less risk now because more people have had it and more people have been vaccinated. When you're never at risk at it, they shouldn't have been given the vaccine for the children. And so I wanted to hold the city and the county officials, elected officials, and the health department and the school districts, I wanted to hold them accountable and say, you guys did this out of your own fear. These children were never at risk. In fact, you adults were never at risk, but you were so scared of getting the virus that you pushed it on children that weren't at risk, that didn't need to have it. This is an unproven, experimental, potentially dangerous and unnecessary vaccine that was pushed on children. We don't know what the effects are going to be, and it's got me concerned that we're going to start seeing more and more reports on the ill outcomes or negative outcomes that we're seeing in children that have been vaccinated. So anyways, I wanted to go speak on that tonight, and I'm going to include that 3-minute clip at the end of this so you can check out and see what I said at the meeting. But I appreciate you guys checking me out, and we'll talk to you later. My name is Dr. Justin Spees, and I protested the child mask mandates around here, along with the child COVID vaccine clinics the city and county supported and hosted in 2021 and 2022. Recently, the World Health Organization changed its COVID vaccination advice, moving children to low priority and thus a low risk group, not needing the vaccine. It's another thing us crazy right-wing extremist conspiracy theorists were right about again. Your very own liberal mainstream media, CNN, published an article on it, and I'll read from it in the WHO statement in a minute. But the WHO says they revised the guidelines due to reconsidering the risk of severe disease and death, but this is a misdirection. It's a lie, because kids were never at risk of severe disease and death from COVID. From the beginning, the death rate of COVID was 0.003%. And this is basically 0%. Nothing is ever 0%, but this is as close as you can get to being zero. And this number was even lower for children, and this was known right away from the beginning. But you all kept pushing these vaccines on children as young as 6 months, all of you. The city, the county, the health department, the school districts all partnered up to push it on kids. And for what? So you grown-ass adults could protect yourselves from the scary virus? Remember when you said us unvaccinated would kill grandma? The WHO no longer considers that an insane argument when considering if kids should get vaccinated or not. When you live in fear, this is what you get. Cowardly adults pushing children to be injected with an unproven, experimental, unnecessary, and potentially dangerous substance. You could say the science changes, but that's exactly why you need to be skeptical in the first place. Contrary to what you dipshit liberals believe, the science is never settled. CNN published an article called "WHO Experts Revise COVID-19 Vaccine Advice, Say Healthy Kids and Teens Low Risk" on Wednesday, March 29th, 2023. The WHO's vaccine experts have revised their global COVID-19 vaccination recommendations, and healthy kids and teenagers considered low priority may not need to get a shot. The updated roadmap is designed to prioritize COVID-19 vaccines for those at greatest risk of death and severe disease. The new streamlined recommendations focus on high, medium, and low-risk groups, and children are in the low-risk group. For healthy kids 6 months to 17 years old, the group said countries should consider vaccinating based on factors such as disease burden and cost effectiveness. This is from WHO's website. SAGE updates COVID-19 vaccination guidelines. The roadmap newly considers the cost effectiveness of COVID-19 vaccination for those at lower risk, namely healthy children and adolescents, compared to other health interventions. The revised roadmap outlines 3 priority use groups for COVID-19 vaccination: high, medium, and low. These priority groups are principally based on risk of severe disease and death, and consider vaccine performance, cost effectiveness, pragmatic factors, and community acceptance. The low priority group includes healthy children and adolescents aged 6 months to 17 years. We were right about masks. We were right about vaccines. Hope I don't start coming in here reading reports about how these vaccines have messed up children. I think that's going to start happening here pretty soon.
General public